Just minutes ago, Pfizer formally asking the FDA to authorize its COVID-19 vaccine for babies and toddlers. Here to answer your question is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Thanks so much for being with us.
Nice to see you.
All right, Dr. Boucher, I am sure there is a collective sigh of relief among parents of children in that age group who have waited now so long for this. We know that you are still waiting to review the data about this 6 months to 4-year-old age group, but what can you tell us about the clinical trials so far and why this seems like it's taken a long time?
Well, you may recall that we had some data initially that the first trials that were done in this age group were not successful. So they had to go back to the drawing board on the dose. And that's how these things work, right? That's how science works. And now we have data on several thousand children who've been studied at this lower dose of the Pfizer vaccine, 2 doses, 3 weeks apart, with reported, according to a press release, very good both efficacy and safety data. So that's good news.
Well, we know now at this point, according to the data, kids are much less likely to develop severe symptoms from COVID. So what do you say to parents who say, do they even need to get the vaccine?
Well, this is an important question. And, unfortunately, what we've seen with Omicron is a rising number of children getting sick enough to go to the hospital. And in fact, the week ending January 22nd, 3.2% of the hospitalizations were among young children. So, for parents, this is important information. And I still think it's better not to get COVID rather than to get COVID. And for my children, we elected vaccination.
All right, let's get to a couple of questions from viewers, Dr. Boucher. The first one's from Anita. She writes this: my cousin asked us to take care of her dog while she recovers from COVID. Is that safe? I want to help her out, but I don't want my family to get COVID. So I guess the question here is, can the dog bring COVID into their house?
There are some data that pets can transmit COVID. It's not really common, and I think the key thing would be to avoid extensive exposure to the dog in terms of licking your face and those types of things. But it should be safe to look out for the dog.
Okay, I want to give you another one. This one is from Connor, and Connor's asking, the FDA says ivermectin can't prevent COVID, but we've seen doctors change their minds before. Is any research being done?
Yeah, very good question. So ivermectin is an antiparasitic drug, and a number of studies have been done. And so far, all the studies have shown no benefit from this drug and some potential toxicity. So really, we need more studies. And I believe that there's at least one study ongoing. So would not take this medicine outside of a study at this time.
And Dr. Boucher, quickly before you go, we had hospitalizations fall under the 2,000 mark today. We had our lowest number of new cases in the state report since November 23rd. So before Thanksgiving, would you go out on a limb here and say it looks like this Omicron surge, at least the worst of it's behind us?
Well, we certainly hope so. I think the thing to remember is that we're still at levels that are quite high if we look back to last year, for example. So we need to hang in a little bit longer, certainly light at the end of the tunnel. And then it's important for everyone to know that our hospitals are going to be busy for some time caring for folks who delayed care due to COVID. So we're not out of the woods yet in terms of the healthcare system, and we just beg your kindness as we get through this.
All right, Dr. Helen Boucher, thank you so much once again for your time and for your insight. We appreciate it.
Thank you.
Thank you.